Hello, my name is Dr. Rajeev Pandarinath. I'm an orthopedic surgeon at George Washington University and the head of sports medicine at GW. I've been in practice for about 10 years now, and one of the things I really like to see is my patients return to their activities. During my 10-year career, I've taken care of athletes in all kinds of different levels, including competitive, collegiate, and even professional athletes. During the coronavirus pandemic, one thing that we've seen is that people's lives and schedules have totally gotten turned upside down. Gyms are closed, fitness classes have ended, and although people have a lot more free time than normal, they're left to exercise with very limited means. Because of this, we often see a change in routine that results in knee pain. A lot of the patients that I've talked to about knee pain in the past few weeks have noticed that their symptoms are related to an increase in their activities or perhaps a change from the normal. A lot of patients are running outdoors or they're doing high intensity interval workouts on video, and they found that they get pain around the knee. Luckily, most of the knee pain that results from these types of overuse activities can be something that we can treat without invasive methods. And patients can often get back to their activities very quickly with some really simple steps. I'm here to give you these steps and talk to you about a few different types of knee pain. One of the most common things that we see in the knee is something called patellofemoral pain, or pain from behind the kneecap. There are a lot of activities that really bring this about, such as running, doing squats and lunges, and all these activities place a lot of stress on the very front of your knee or your kneecap. People feel pain around the front of the knee, and they feel like they can't keep their knees bent for long periods of time. It hurts to go downstairs. They can't sit cross-legged. Another common thing is IT band syndrome. Now, the IT band is a very thick and strong tissue that runs from the hip down to the knee. It runs on the outer side of the hip to the outer side of the knee, and it's often stretched out when you're doing things such as going down hills or stairs or running on uneven surfaces. When you do these things, the IT band gets stretched, and the IT band actually rubs on the side of your knee, causing inflammation and pain. A third thing that we commonly see is tendonitis, which just means inflammation of a tendon that's around the knee. Some of the most common tendons that are affected are the quadriceps tendon, the patellar tendon, the hamstring tendons, or some of the tendons of the calf muscles. There's really a few simple rules that you can use to treat knee pain. As long as you don't see any swelling. Swelling is something that we see in patients who have more structural injuries to the knee, such as the meniscus, the cartilage, or even the ligaments. If you see a lot of swelling in your knee that is associated with your pain, you may want to go ahead and call your orthopedic surgeon and schedule an appointment. If you don't see swelling, there's a few simple steps that I would recommend starting out with. One is rest. So rest and taking down the activities a notch would be really helpful. This really means cutting out things such as running, squats, and lunges, or at least decreasing the activity level to a point at which you're not having as much pain. Icing the knee can be really helpful with bringing down inflammation, and it's also helpful to take anti-inflammatory medications. Now, this is a group of medications that's relatively safe, but there are certain medical conditions that preclude you from taking the medications. If you're not sure if you're allowed to take anti-inflammatory medications, you should consult with your primary care doctor prior to starting any of these. If you've done all three of these things, the rest, the ice, and the anti-inflammatories, another thing that you can add is some simple rehabilitation exercises. In the link below, I provided a link to some exercises that you can do that are really safe for the knee and can help with some of these common problems. If you've done all these things for 2 to 3 weeks and the pain is the same or getting worse, it may be helpful to schedule an appointment and see if there is something else going on. Now, at our office, we're very cognizant with the risks that people face when they go to a doctor's office during the coronavirus pandemic. Because of that, we've created the telemedicine option. And what that is an option for you to schedule a virtual visit with me and talk about your knee pain and symptoms. Usually by the end of the visit, we can develop a plan of care and figure out a way to solve your knee pain. If there's further imaging needed, such as x-rays or an MRI, we can set up a time to do that. And hopefully with the virtual visit, we can get you on your way to a recovery. To schedule a virtual visit, click on the link below or visit www.zocdoc.com and search for Dr. Rajeev Pandarinath. I look forward to helping you with your knee pain in any way possible. And thanks for your time.